Hello, Miss Ilknur. Miss
Hello?
Ilknur, when it comes to neonatal surgery, families are very scared. What is the importance of early diagnosis and timely intervention for conditions like esophageal atresia and diaphragmatic hernia?
These diseases we mentioned fall into the group we call congenital malformations, meaning congenital anomalies. Esophageal atresia is a condition where, due to the esophagus being born blind, children cannot swallow their saliva, which can lead to aspiration into the lungs and result in death. Therefore, early intervention is very important in these patients. In esophageal atresia, intervention is generally required within 12 to 48 hours. Diaphragmatic hernia is a different disease group. In diaphragmatic hernia, children may be born with respiratory distress immediately after birth. Therefore, treatment must absolutely be carried out in a tertiary hospital, in places with a neonatal unit requiring a multidisciplinary approach. Once these babies are detected in the womb, the intervention to be performed after birth should be planned and carried out in such centers.
Thank you, Miss Ilknur. Conditions like hypospadias and undescended testes can sometimes be noticed late by families. Why is early diagnosis so important?
Early diagnosis in undescended testes is very important because if not diagnosed, it results in organ loss. In the adult age group, it results in infertility. But with early intervention, what age do I mean by early intervention? Now, in the new guidelines, this period has been reduced to 6 months. The testicles should be brought down to the scrotum by around 1 year at the latest.
Thank you. What is Wilms tumor?
Wilms tumor is the most common solid tumor of the kidneys we see in the pediatric age group. It constitutes approximately 85 to 90% of kidney origin masses. We generally see it most frequently in the first 5 years. It is mostly seen unilaterally, but in 10 to 15% of cases it can be bilateral, meaning it can occur on both sides. A multidisciplinary approach is very important in oncology patients, especially in children with Wilms tumor. The initial surgery is crucial. A radical nephrectomy needs to be performed. The tumor-affected kidney tissue and ureter need to be removed. Depending on the stage of the mass that is removed, there may be a need for chemotherapy and radiotherapy.
Thank you. In your opinion, how effective is early diagnosis in the treatment success of childhood cancers like Wilms tumor?
Early diagnosis is 100% effective in the treatment success of solid kidney tumors. Since Wilms tumor is the most commonly seen tumor, when diagnosed early, that is, in stage 1 and stage 2, there is over a 90% chance of cure. But when diagnosed late, distant metastasis, that is, stage 4 and above, since it presents with liver and lung metastasis, the chance of treatment success is lower in these cases.
Diseases like hypospadias and undescended testes are sometimes noticed late by families. Why is early diagnosis so important?
Hypospadias is one of the most common urinary anomalies in boys. It refers to the placement of the urethral opening below its normal position. In other words, it is when the urethral meatus is not on the glans penis but lower at the midshaft penile urethra level or even lower. What can this cause? It can cause problems with urine flow. It can cause problems with having children at older ages. It can lead to infertility and cause curvature of the penis during erection.
Therefore, it is a surgical condition that definitely requires intervention.
Who is operator Dr. İlknur Banlı Cesur?
After graduating from Erciyes University Faculty of Medicine in 2004, I started my pediatric surgery residency at Çukurova University Faculty of Medicine in 2005 and completed my residency in 2011, beginning my role as a pediatric surgery specialist at Adana Numuni Training and Research Hospital.
I have been working in the pediatric surgery community for approximately 20 years. I have specialized particularly in oncological surgery, urological surgery, neonatal surgery, laparoscopic surgery, and abdominal surgery.